Good morning. I'm glad you came today. My name is Bill Cothran, and this is my wife, Susan, and we are lifelong residents of Alamance County. We have offices here in town. We've been in business for 28 years now, specializing primarily in Medicare. And we are going to just run through it. But there's some things that I do have to tell you to be compliant with Medicare. This is registered with Medicare, and there are certain things I have to tell you. Number one, we are licensed insurance agents in the state of North Carolina. We are appointed with several major insurance companies, and we're authorized to offer their Medicare products. Today we're going to cover the parts of Medicare, ABC of Medicare. Medicare has Part A, B, and D, prescription drug. There's another part, Part C, that I will not cover. It takes about an hour to cover that part. I'll just tell you some basics on that, quick information, and you can contact us if you want more. Medicare. Medicare has enrollment periods. When you first go on Medicare, whether turning 65 or some other special requirement, maybe you stayed on group coverage and waited until you were 66 and then went on Medicare Part B, but when you do, you have a 7-month window in which to make basic choices about your Medicare. That 7-month window includes the month of your birthday, 3 months before your birthday, and 3 months after your birthday, in which you can make your Medicare choices. And depending upon what you do, there's no health questions asked. You would automatically qualify for the products. So that is your initial enrollment period. After that, there's an annual enrollment period in which you can make changes to your Medicare coverage. That occurs currently from October 15th until December the 7th. You can make changes. They do not become effective until January 1 of the following year. Medicare changes every year. They make changes, so the products that are associated with Medicare change every year. So you do need to keep up with it, especially when we get on the drug portion. You need to make sure your drugs are covered. So that is very important. A few people will have a special enrollment period. One of the special enrollments, if you're leaving group coverage, people work to 66, they leave group coverage, they can take out Part B then, and they would have a special enrollment, and there'd be that 7-month window for them. Hold your questions till the end. We are going to go quickly, and we'll try to get to questions later on towards the end. When you turn 65, you get Part A automatically. They'll send you a card saying you have Part A. Part B, if you're taking your Social Security retirement, you get that automatically. There'll be a card in the mail. If you're on group coverage that qualifies, you can deny or turn down Part B and continue on your group coverage and get a special enrollment when you're ready to leave your group coverage. The premium, as I said, for Part B of Medicare for most folks is $104.90. It is based on your income. Higher income would pay more. Lower income would pay less. If you don't take Part B out when you qualify, coming off of group coverage past 65 or turning 65, later on you decide you want Part B, there is a penalty involved in that. And the penalty is 10% per year that you could have had Part B of Medicare and didn't take it out. And that will last for 2 times the period you did not have it, that penalty. A lot of this is in Medicare and U 2015. They will send that to you when you're turning 65 and every year thereafter. Great publication, a lot of information that is from CMS or Medicare. CMS, you'll see those initials a lot, stand for Centers for Medicare and Medicaid Services. Medicare Part A. Medicare Part A is your hospital insurance. Yes, pass that out. Most of the information is on here for Part A. You can use it. I'll tell you to mark on it in a little while. But when you go into the hospital first time, there is a per cause deductible of $1,260 per cause. That is not a yearly deductible. If you went into the hospital, came out for 60 days, went back in, you would have another deductible. You could have 5 deductibles or more. Never heard of anyone having that many deductibles in a calendar year, but it is possible. And this is one of the reasons people look for supplements, and we'll quickly cover a supplement in a few minutes. Okay. If you're in the hospital, that covers days 1 through 60. If you're in the hospital more than 60 days, 61 through 90, it's $315 per day for additional days. Most people are in the hospital 3 days or less. They get you in and get you out quickly. They don't want you in the hospital any longer than absolutely necessary. If possible, they'll send you to skilled nursing or long-term care to get you out of the hospital. Few people have been in the hospital more than 90 days. Days 91 and beyond, it's $630 per day. And that is your obligation. All of these figures are your obligation. If you're in the hospital 3 days and need skilled nursing, they would put you into skilled nursing days 0 through 20. You would pay $0. Days 21 up to 100, you would pay $157.50 per day. That is your obligation if you're in skilled nursing. Again, most skilled nursing is 20 days or less. That's a short-term type of nursing care. It's more rehab. There are some qualifications under Medicare for that. Number 1, you must be in the hospital 3 full days prior to being entering a skilled nursing. 3 full days. If you're in there 2 days, you don't qualify for coverage under skilled nursing. While you're in skilled nursing, you must be improving. They have benchmarks. If you stop improving, then you do not qualify for additional skilled nursing care. Also under Part A of Medicare, there's a blood you're responsible for the first 3 pints of blood. After that, it's covered. You would pay 20% of the cost after the first 3 pints of blood. Any questions on Medicare A? Hospital. Yes?
When you said you have to be in hospital 3 days, is that admitted into the hospital?
It does not include admitted, but it does not include the day of discharge.
3 full
Good
days,
question.
You must be an inpatient. That is the correct phrase.
Good question.
Just under observation.
That's a different area, that's under Part B. Very big different area.
Any other questions? Yes, sir.
These amounts go up regularly? Or?
Yes, sir. Every year they go up. And with Medicare, there is no limit to your obligation. That's your percentage or your copays. No limit. And this is especially important under Part B, and I'll tell you a little bit more about that. Any other questions? Good question.
You said something a while ago, and I wasn't quite clear on it. You were talking about Part B. When I turned 66, I've got so many months before and after to go to Part B.
You do, yes, but normally if you're
But I'm
eligible,
covered now.
if you're eligible for Part B and are not on group coverage, you need to take it, or there could be a penalty.
Okay, but as long as I'm under group coverage, I don't have to go to Part B, or should I, when I turn 66?
Depending upon your insurance, most cases I would not.
Okay.
You're paying for something you're not going to use.
And so I wouldn't be penalized, say, if I retired at 70.
Correct.
Okay.
Now, when you do retire, you'll get a letter saying you had insurance coverage from this date to this one, and it was creditable coverage. You better hold on to that letter. We've had Medicare come back as long as 3 years asking for that letter. So hold on to it. That is important. Good question.
One point, group coverage, it has to be over 20 employees, which it is at Elon, but some of the smaller that have under 20, then they're obligated to go on Part B. Most of the time, they are required to do that with their employee.
Okay. Any other questions? Okay, we'll run right along. Medicare Part B. That covers your outpatient or your medical doctors and outpatient surgery, outpatient care. With that, there is a yearly deductible. This year it's $147. If you meet that deductible under one Part A, under Part B, it's met for all items under Part B. $147 yearly deductible. After the deductible, Medicare is 80-20. They pay 80%, you pay 20. There's no stop loss on that. Several years ago, my wife had cancer. Her surgeries were outpatient. She had radiation, chemo, the bills were over $160,000. Had she been on Medicare only, our obligation to pay would have been $32,000. And again, that's the reason you want to look at a supplement or some other type of policy. During the, when you initially go on to Medicare Part B, again, you have that 7-month window in which to sign up for any additional product. You also have a deductible under this for blood. Again, it's 3 pints of blood. However, if you're in the hospital and you have 3 pints or more, you've met your deductible for Part B. If you meet it under one part, you've met it under the other, but it's still there. If you need blood, you have to pay for the first 3 pints of blood. Diabetic supplies, that's 80% paid by Medicare, 20% is your obligation. Services must be Medicare approved. There are some services that are not cosmetic surgery. I'd like to have that. But there are some services that are not covered. If you're in the hospital, for instance, and they break out the TV or that toothbrush or whatever, that would be your obligation. That's not covered by Medicare. In this area, you just have a room charge. You don't have to worry about it. It would be covered. Foreign travel is not covered by Medicare. if you're traveling, you need to check into travel insurance, ask your travel agent. We've had 2 people over the years that were caught in a foreign country needing medical care, and they had to pay the full amount before they got out. One of them was in Mexico, and he didn't have the money to pay, but luckily his company paid, sent a plane to pull him out, brought him back. Then he went into Duke. We had one lady, and she was teaching in India and was not covered by Medicare. Okay. Any questions on Medicare Part B? That covers outpatient. Oh, one thing not covered by Medicare, long-term care. Your skilled nursing is, but if you need long-term care, it is not covered by Medicare. You would need a separate policy for that.
In the Part B, the young lady, the observation room is covered under Part B. And that's been a big concern because a lot of people now, when you're in the emergency room as a rule, and you're not well enough to go home, they will put you in a separate area. It's called observation. And in Alamance Regional, they used to take you upstairs. And so we've had clients that said, well, I went upstairs and they thought they were an inpatient. So that is something, to make sure you're not sure where they have moved you, to ask if you are in observation room. And that's covered under Part B.
So observation is covered under Part B.
Yes, as long as it meets all the criteria for Medicare, but we've never had a situation with one of our clients where it was not.
But under Part B, you have the $147 deductible, and then it's 80/20. Medicare pays 80, you pay 20. Okay. I'm running a little ahead of schedule, so we have time for some questions. Medicare Part B. There is one, yes.
The foreign travel, because I do a lot of that during the summer, in a supplemental policy, can that be covered, or is this an entirely separate thing you've got to get if you travel?
There is some, but again, I would recommend that you get travel insurance to cover that. One part of Medicare Part B is something called excess charges. If you go to a doctor and he charges more than Medicare approved, he can charge up to 15% above Medicare. And that would be your obligation under Medicare to pay, the excess charges. Any other questions? Most of the doctors in this area, especially primary care, they accept Medicare assignment, which means they will not charge you for excess fees. You would see it more in a specialty doctor, surgeons, and so on. And again, in this area, most of the doctors accept Medicare assignment, and you don't have to worry about the excess fee. We've had one in Pleasant Garden that for a while did not accept Medicare, and he changed because of the graying of America.
Yes,
Sir?
An Advantage plan, is that a supplemental?
It is not. It is not. His question, the Medicare Advantage, are they a supplement? It is not. It's a totally different area, and we're not going to get into that today. That's at least an hour, but it's a good alternative, and you need to explore that. Okay. Any other questions? Yes, sir.
Then what's the advantage or disadvantage of Part C versus A and B? When should we be considering the Part C?
That's a good question. I'll get to it in a few minutes.
Not a network of doctors.
So,
The network of doctors, like you do.
in Medicare, there is no network, original Medicare. When you get into some supplements and Medicare Advantage, there is a network of doctors.
But with original Medicare, the red, white, and blue card, you're going to turn 65 and go in on the Medicare, get the red, white, and blue card. The doctors must take Medicare, and they must say that they will bill Medicare. So, but we don't know of any doctors that do not take Medicare.
In this area.
Yes, in this area.
Okay. Good questions.
Yes.
Anymore? No? Okay. I've shown you the problems with Medicare. Medicare is still a great insurance. And to me, it's probably the best in the world, just Medicare. But there are some holes in Medicare. For that reason, a lot of people will look to take out something to help them with these expenses. A Medicare supplement is one of them. With a Medicare supplement, there are certain enrollment periods for you. When you first go into Medicare Part B, you have that 7-month window, the month of your birthday, 3 months before, 3 months after, in which you can sign up for a Medicare supplement, and there's no health questions asked. We've had people to go on Medicare, go on different products, and they've had or were under active cancer treatment. The end of 1 month, they went off the group coverage, went on to Medicare and a supplement, covered immediately. No health questions. After that 7-month window, you are going to have to qualify health-wise to change your Medicare supplement. In the 90s, Medicare did something I thought was really good. They standardized Medicare supplements so that if you take a Medicare supplement Plan F from one company, it pays identical to a Plan F from another company. Makes it easy for you to compare the plans. In North Carolina, if a company wants to offer a supplement, they have to offer Plan A. From there, they can pick and choose plans from B up to N. There are lettered plans. The most popular is the F plan. Your Medicare supplements nor original Medicare, neither will cover prescription drugs. That's totally separate. Your Medicare supplements are not offered by Medicare. It's offered by a private insurance company, and there is a premium involved in that. Question? The premiums on Medicare supplements can go up every year. The supplements are kind of designed to fill in the gaps that you see here. What are the differences between Medicare supplements offered by one company versus another? Well, of course, price, and the prices vary tremendously. Every year in North Carolina, we have people coming in with a Medicare supplement, ultra cheap, and then they start going up, and in a few years, exponentially, what happens? The prices are going up. You have healthy people leaving the plan, unhealthy are stuck with the plan. And the prices are based on loss ratios, so the more losses a company have, the higher the increase that they can get. You also want to look at the stability of the company and customer service. So there's 3 things for you to look at when you're trying to pick a Medicare supplement: price, service, and stability. Again, I said Medicare A and B, there's no maximum out of pocket, but if you had a supplement, it could help. Susan, are you ready for the supplement?
Right.
Okay, the supplement kind of fills in the gaps, and listen to her and watch me.
Yeah, Bill, the co-pays and so forth, and the first 2 handouts are Part A and B, and the deductibles, that's your obligation. And with the Medicare supplement, as Bill mentioned, they're from A to N, and different companies can offer certain plans. They don't have to offer every Medicare supplement. And on this little handout, it is what the United Healthcare AARP offers. These particular ones in the Plan F is by far, over the many years, has been the most popular plan that people have wanted to take it out. take out. And as Bill mentioned, when you're in that open enrollment period, there are no health questions. And also, there's no question if you smoke, if you use tobacco in North Carolina. I'm not sure about some of the other states, but I do know in North Carolina, they can't answer that question. And the Plan F, the Medicare supplement, your original Medicare, the red, white, and blue card that you will receive that has Part A and Part B on it, that pays first. And the deductibles, the Plan F, when you go into the hospital, the $1,260 deductible, that's your obligation, is paid by Plan F. And everything that I'm going to go over, as long as it's something that Medicare says it is covered, it's medically necessary and something Medicare will cover. And so the days 61 through 90, your Plan F would pay the $315 per day, and then Medicare, original Medicare would pay the balance. The 91 through, from days 91 and beyond, the $630 per day. I usually don't go over that because you're not going to be in the hospital longer than 60 days, as most everyone in here knows. And
But it's paid if you are.
correct, it is, if you have the supplement. And if you go into the skilled nursing facility after having a 3-day inpatient hospital stay, and it has to be 3 full days, the day of discharge is not counted, and you go into the skilled nursing facility, the doctor does give a plan of care, and there's certain criteria. After your plan of care, you have to be in an improving situation. The first 20 days are covered in full by original Medicare, so your supplement would not pay a copay. Days 21 through 100, if you're still meeting all the criteria, there's $157.50 per day copay, and the Plan F would cover that. After 100 days in the post-skilled nursing facility, if you should be in there longer than 100 days, it's your obligation. Original Medicare will not cover the copays, and no one's Medicare supplement will pay either. So that's why Bill mentioned in certain situations, look at long-term care coverage. Your first 3 pints of blood is paid in full by the Plan F. In hospice care, Medicare pays all for very limited copays or co-insurance for outpatient drugs and inpatient respite care. And so Plan F will pay those copays. And for your hospice care, it has to be a Medicare certified hospice facility. And really that would be the only type that you would want to go into.
Yes,
Yes, sir.
For the supplement, you would have to use 65. You don't take anything except Part A.
Part A, okay.
Right. You have, as long as you're still working and recover with an employer as a primary insurer rather than Medicare, when you stop working and don't have that coverage, then you still have a window where you can.
That is
complete-
correct.
special enrollment.
If you work to
And
age
there's no
70,
penalties.
that is correct. That is correct. Okay, getting under Part B, yes, sir.
On Plan F, do they cover any of the 80-20 split?
Yes, that's
Our
what,
20?
Yeah, that's under Part B. We're getting to that now.
Okay.
very good. We didn't get in enough books, so I didn't have one to hand out to everybody. They changed the books and made them much thicker this year also. Part B is Bill went over before, is your medical expenses, and that's treatment in or out of the hospital. When you're an inpatient in the hospital, your doctor, he or she coming in and doing the surgery or whatever they may do, is paid their portion, their bill is paid under Part B. All of your outpatient surgery, which now the majority of a lot of, all my cancer treatment, most of my cancer treatments, surgeries were outpatient. And the observation room is covered under Part B. It does have a true calendar year deductible of $147. And that, the Plan F will pay that. And then the 80/20 that you're speaking about, because generally Medicare will pay 80% and the other 20 is your obligation, then the Plan F would pay that 20%. If, as Bill mentioned, your doctor does not take assignment, and in your group health is generally called usual and customary, then there can be a 15% extra cost that they can charge you, and the Plan F would pay that. But there's less than 3% of all the doctors in the nation that do not take assignment.
So basically, if you have a Plan F, it covers the things that Medicare or your obligation under Medicare A and B. There may be a few things that aren't covered. There's certain eye drops with cataract surgery. It's very, very limited as far as your output for these items. But yes,
So then all we're out is the premium we pay for Plan F.
that's correct.
Or, there's some other plans. The F is the most popular. Once I start discussing a plan, I have to continue it. And so for time, I just went over the Plan F. The blood deductible under Part B, if you haven't met the $147 copay, it would pay that, and then it would pay the balance for your blood. And the other 20%, this would pick that up. Clinical laboratory services is covered at zero copay because Medicare covers it, as long as the lab services are covered by Medicare. And just like with your group health, there are certain time frames for certain labs that will be covered, like cholesterol, the A1C. I just had my A1C. So things of that nature, but it would be covered at 100% as long as it's in the time frame and something Medicare does cover.
Any questions on a Plan F or other supplements?
What are Plan Fs kind of going for these days? The big question.
From here to there.
4,000.
Prices are all over. I mean, they can run from around $100 a month. We've had some people $600 and some dollars per month. And on the upper end, it's companies that came in with a low price and their prices went up exponentially.
You're getting the same coverage, whether you're paying $100.
Same coverage. You may not, the different companies may not pay timely or give you the customer service that another company would. So that's the reason I said you need to check that, check stability of the company. What's their rate of increase over the years? The Plan F by far is the most popular. And again, it's offered by private insurance companies and not Medicare. Any other questions?
If you start with company X, let's say company XYZ Plan F, and you're dissatisfied after a year, do you have options to change to another company?
If you qualify health-wise, there is one other way. If you have a plan that withdraws, they cannot cancel on you individually, but if they withdraw their plans from the state, you have a special enrollment in which you can go to another company, again, without health questions. So that's another consideration. There's a lot to, there's 30-some pages of special enrollment periods that people have.
So you need to choose carefully because you're really stuck with them.
Excuse me?
You need to choose carefully on the company you choose because you're more or less stuck with them.
That's right.
You can do that.
That's correct.
So how do you find the information?
That's horrible.
How can you tell they're stable, or is there one source you can go to rather than ask a lot of different people, what are your charges?
There is a website, www.medicare.gov. They have a lot of information. It doesn't tell you exactly the stability of the company. You just have to ask people.
So you do Medicare, even for the check Medicare's website, even though it's the
Correct.
the AARP product.
They won't have that specifically on the supplements. They do list some products another way. I can help you. Yes, sir.
Yeah, I think the thing to understand is there are a lot of companies that provide supplemental coverage, not just AARP.
Correct.
United Healthcare. In fact, the university offers a supplemental coverage to another company, and we subsidize it, but at $100 a month, so you pay all the increases in the premium cost over the years, but you get $100 if you choose this one. That's not any pressure by the university to choose this one. It's just we felt like we had so many employees, maybe we can go out and find someone who would be willing to give us some kind of deal on the potential number of people that we had, you know, to give us a better deal for our employees. So that's one option to consider, but there are a bunch of companies out there that are options. ARP happens to use United Healthcare. This is an example of how that
Correct.
works. Okay, but
Correct.
certainly not the only one.
Yes, sir.
So, do most people, is this related to Social Security in some way, this supplement, do they have it deducted from Social Security, or do you pay that?
That's a very good question. No, Social Security will not deduct a premium for your Medicare supplement. You have to either choose to have them bill you each month, which most of your companies don't want what's called a direct bill, or have it as a bank draft. Or you can choose to pay it on a quarterly basis or 6 months. Each company has, you know, slight variances there. That is a good question. It cannot be deducted from your Social Security.
Okay. One more question.
Ron, what's the Elon recommended plan running now?
It's not recommended. Sure, do you know what?
Or offered?
Monumental?
243 is your portion.
43, and then
243.
you supplement, so it's really 343 or something, you supplement 100.
Yes, and that information's on our website.
Okay.
Okay.
So it's somewhere in the middle of that, at the lower end of the middle range between 100 and 600.
Okay. All right, prescription drug coverage. Certain things, again, by Medicare, I have to include before we get to the plans. Number one, the same 7-month window to sign up for a prescription drug plan. The month when you qualify for Medicare Part B, your month of your birthday, 3 months before, 3 months after your month of your birthday, you can qualify and take out a prescription drug plan. After that, you can make changes during the annual enrollment, October 15th to December the 7th. It would be effective January the 1st. That's after your initial enrollment period, that's the only time you can make changes. If you're coming off of group and have a special enrollment period, you can take out a prescription drug plan. The prescription drug plans are offered by private insurance companies. There is a premium involved in that. Medicare has a base plan that all Medicare plans must, the standard that they must meet or exceed. The minimum standard has a $320 annual deductible. Then it goes into your obligation will be 25% of the Medicare approved prescription drug costs. Until what you've paid, what the plan paid, added together, total $2,960. At that point, you enter something called the donut hole or coverage gap. Or if you're one of our Yankee friends, it's a bagel hole. But in there, you pay for the cost of the drugs. You pay 65% for generics, 45% for brand names, until you've paid $4,700. At that point, you would come out of the coverage gap and you'd go into catastrophic. You'd pay a couple of dollars for generics and up to $6.60 for brand name, or 5% of the cost, whichever's the greatest. Very few people actually go into catastrophic. Quite a few will go into the coverage gap. You probably know people, if once you're on Medicare, that's what people talk about. I'm in the coverage gap. Okay. Other than that, there is a penalty involved if you do not take out a prescription drug plan in a timely fashion when you qualify. And that penalty is 1% per month for every month you did not take out a plan and you were eligible to take it out. And you pay that continually until you either pass away or decide you don't want drug coverage. Yes, sir.
Does that still have the same option as Part D, to where if you got primary coverage, you don't have to take it until you no longer have that?
That's correct. That's
It
part of
must
it.
be credible coverage,
Right.
and you do have it here, I see your program.
And you do keep that letter when you get
Still have
it.
that 7-month window.
Correct. Now, on prescription drugs, no pre-existing conditions, you're covered immediately. Or January 1, if you're renewing, you can make changes annually with that. It would behoove you to check your drugs yearly to make sure it's covered by the plan. Plans have a formulary of drugs that they cover. If your drug's not on it, then you have to go to another drug that's covered, file for an exception. They have 72 hours to give you a decision, or pay for it yourself. So you do need to check your prescription drugs. Companies have a network of pharmacies that you must use to get the coverage. Your drug coverage is in tiers. Most plans run from tier 1 to 5. 1 and 2 would be a generics, 3, 4 brand names, and the 5 a specialty. And the copay varies from company to company. There are quantity limits on certain drugs. There's prior authorization, and there's something called prescription drug therapy management that helps you manage your drugs, see if you can get your costs down. Okay, those plans, you were asking prices. Plans run from $15 to $100 and some a month. And if you're looking for one, make sure whoever you're talking to will run your prescription drugs to ensure that they are covered, okay? There are some drugs that Medicare will not cover, sleep aids, so on. Any questions on the drug coverage? Yes, sir.
Are there supplemental plans to cover the donut hole?
The supplements do not include drug plans, and your prescription drug plans all have a donut hole.
So there's no supplemental insurance to cover the donut hole?
Correct.
No, they won't do that
So
anymore.
we're just all stuck out.
You take your Medicare, if you take the original Medicare, your red, white, and blue card, your supplement, you'd have to take out what's called a standalone Part D to cover your outpatient prescription drugs.
Okay. Any other questions?
And how much is that?
There's a range there. The average range, which most of what we sell, is with about $49 per month for the standalone Part D.
Now, that's the Medicare, that's not what you said.
No, Medicare doesn't cover prescription drugs.
Yes, ma'am, the standalone Part D is an insurance product, and we do offer that. We do offer that.
So that's not for Medicare, that's for you.
That's correct, but it is
From an insurance company, we do
I
offer.
think
But the government
That's-
mandated that happened.
correct,
Correct.
correct.
the point is, though, just the point I made earlier, and that is, there are a lot of companies that provide that, okay? Their company is one of them, okay, but there are a number of companies that provide the same kind of coverage.
Correct.
And that's where Bill's talking about being careful, looking particularly at supplements and with this as well, to try and get the best deal.
Yeah.
Correct.
To me-
It's someone that runs your drugs, because when I deal with people, I get a list of their drugs. I usually mail it to me or email it, and I run the program to see which would be the better fit for your situation.
Two quick things and we're through. We cannot contact you out of the blue. You have to make the first contact if you want to talk to us or you want us to call you. Several ways you can do it. You can email us. We've got a card. You can put your name and telephone number on. All that does is give us permission to call. We will not come out to your house and knock on doors. It's illegal. even so, there are people in this county that do it. If you want an appointment, Medicare requires two things. Number one, we have your permission to talk about certain items, and that's all we can talk about, plus permission to come out for an appointment. We cannot come out again and knock on your doors or call you or send you an email without you initiating it. So you don't have to worry about that. We don't take a roster. We're not allowed to by Medicare. Any other questions?
Now, is your email address correct here?
Yes, ma'am.
Be an ad on it?
Yes, ma'am.
Oh, that's the card that was printed. See, they gave us those cards.
Yes,
They
it's
made mistakes.
So what is it?
ask, which one is that one?
It says
Yeah,
Bill
that- we
Conference
used- I picked up the box that was wrong,
doesn't
I'm
have an
sorry.
ad.
Oh, yes, it should be at. Those were misprinted, I'm sorry. Bill Cothran at netscape.net. Yeah, I'm sorry.
Okay,
Yes.
so let's see if I've got this right. If we want to get fairly full coverage, let's say, I don't know what you call it, Part B would run a 104.90 or a little more or a little less, depending on our income. If we took the Elon's Part F, it would be $243 a month. We did a Part D that you were saying about $49 a month, and the total would be $396.90, so around $400 a month is what we're
Correct.
looking at for full, relatively full health care.
Correct.
I will go
Correct.
over the AARP, turning 65 for 2014. Plan F is 100, if you do it on Backdraft, it's $142.
Oh, so it's less.
Correct, and something that,
Yeah, AARP.
each year as you get older, your premiums do go up to your age. It doesn't go up because of your usage. Everyone that has a Plan F, that's 65 will have the same rate that lives in North Carolina. And with the AARP, it will, when you turn 75, it will not go up each month because you're a year older. It will go up. Another trend factor is due to the loss ratio.
Okay. One other quick point, someone brought it up about the Medicare Advantage. That is called Part C of Medicare, and it is offered by a private insurance company. It combines A, B, in most cases, prescription drug coverage, A, B, and D. It has extra benefits that are not covered by Medicare or Medicare supplements, and it can be a zero premium. You would have to continue to pay with $104.90 Part B premium, but they go from zero premium. It can be up to $100. So that's Medicare C. Again, if you want to talk about that, you can call us.
So C comes up less than doing it the other one.
You do have copays though.
Oh, but you get the co-pays. Okay.
Correct. I'm on C.
It has a max out of pocket, so that's the factor you look at the two and just compare it and look at your health situation, certain things.
I had total
Sit
knee,
down individually.
I had total knee replacement 2 years ago here in the hospital. My bill was $27,000. I paid less than $600 copay. It's in the hospital 3 days. Yes.
There's one more. Ron, for the Elon kind of sponsored Plan F, is that something then you get to change if they're not any good? And so does that kind of help us make the decision on reliability instead of going with some other firm? Because you guys do a kind of reliability check on.
Yeah, no, I think you need to consider that to be just one of the options.
Just one of the options.
Yeah.
Yes.
Okay.
There's no special protections or anything like that. It was just an attempt on our part to try and see if we could get a reasonable deal for our employees.
It would
But
come.
they've got to be looked
Yeah.
at the same way.
It would come under Medicare. Medicare would control that. And you do have all the protections that Medicare offer when you do that plan.
So
That part as well.
you're stuck in that too for a period of time. You're not going to switch that.
It's not going to
company
be
out.
any different than any
Okay.
other option.
So we still have to do that comparison and
Yes.
evaluation.
We strongly recommend that. In fact, we don't make recommendations out of our office for that reason.
Okay.
Because
What
really,
firm is the one we?
Monumental is the company.
Monumental. Okay.
And when you, at the point at which you decide you're going to retire and we know that, we'll send you information about it. Or do you want it sooner, we can do that too.
So you said that Plan F is the most popular, but it goes to Plan N. Is Plan N the best?
I can't say it's best. It has different benefits. Some of the plans past F, you would have some deductibles and copays. There are things that they may not cover. The most comprehensive is the F.
That's why we chose it. And if I mention anything about N, I'd have to go over the whole program, so we're not allowed to repeat either of these, just a couple.
Yes, sir.
So I know you're not here to talk about the Advantage plan, but is that an option?
Yes. If you look on your chart, you have two options. You can take, when you get Medicare A and B, you can stay with that only. You can add a supplement, you can add a prescription drug plan, or you can go to Medicare C. That's on that chart we gave you. Those are your options under Medicare.
When we started with you with the Part C, the Medicare Advantage, I usually ask who your doctors are, your hospital. That's what I'm looking for, the doctors in the network, to see if they would be covered. And then, of course, I would ask your drugs, your medication, to run those and tell you what your copay would be on that medication.
And there's no charge. We do not charge for consultation. If you want to come and talk to us, you call us on the phone, you can come to our office, there's no charge. Any other questions? Yes, ma'am.
Okay, you choose a particular drug plan based on what you're taking right now, then you get diagnosed with something that, you all of a sudden you're taking meds that you had no idea you would ever be taking. Is that when you end up falling in the donut hole because there's no way that you can't regroup because you have been diagnosed with
It's
something?
possible. We can run your drugs beforehand, and if those drugs would put you in the donut hole, we can tell you. Okay. Question? If you need to go, it's almost 12, 5 till, but we'll be here if you have a question, if you want to discuss it with us or whatever. Thanks for coming. I appreciate it.
I'm doing it right